My name is Dr. Vivek Solanki, and I'm a periodontist. We're at Modern Day Smiles in St. Petersburg, Florida. Both of my parents were dentists, so I grew up, daycare was in the dental office. I would come home from school, I would learn a lot about dentistry, which changed a lot over time, but I was around it a lot. It was only until I went to dental school where I figured maybe I don't want to do the same thing my parents did, which is general dentistry. And so that's why I decided to become a specialist and specialize in periodontics. Periodontist is somebody who focuses on the surrounding structures that support the teeth, right? So the gums, the bone. We replace teeth with dental implants. We focus on treating periodontal disease, which is the #1 leading cause of tooth loss in the country. I often tell my patients that periodontal disease is like high blood pressure. We don't really know we have it unless we test it, right? We check it. The traditional model of dentistry, which is nothing wrong with it, is where a patient would come to their general dentist to get care. And then there may be something that the general dentist did not feel comfortable with, was outside their scope of training, and they would say, you need to see Dr. So-and-so. You know, they're a specialist in oral surgery, root canals, periodontics, but you have to drive across to their town. And that model is where the patient has to kind of fend for themselves. Is that specialist in network with my insurance? Is it going to be easy for me to get there? Am I going to like their staff? Am I going to like their team? Foreign land, right? When a patient goes to the hospital, they don't tell the patient that, hey, we don't have the doctor to treat you here. We got to send you to another hospital. In dentistry, where things are moving is that we try to have the specialists in-house here. We want them to be able to see all providers that participate with their same insurance. So whether you have to see somebody in a general dentistry field, or whether you need to see an oral surgeon or a periodontist for specialty services, everything is here. It's the same treatment plan. We all participate with the same insurances. We want that convenience factor so the patient doesn't have to figure out what they do when they leave the general dentist office. The experience that I've gotten over the last 10 years has not only allowed me to provide great patient care, but it's allowed me to uplift the doctors around me, to create this culture that we are here to provide the best dentistry for patients, and we can do it under one roof. The last 2 years has been exciting. You know, we see so many compliments from patients like, wow, this office is great. We drive down the road, it's beautiful. The inside looks nice. You know, we want this office to become a place where we would want to get treated, right? A nice, clean environment, a friendly team, great patient care, the latest technology, implants done in the same day, you know, come in and get a smile makeover. Everything at the convenience of what we want to do. Multiple facets of dentistry in the same vicinity. It's very rare that patients can come in with Medicare Advantage plans, with PPO insurance plans, no insurances, and be able to be treated by general dentists, specialists, the hygiene team, all in the same place. That is challenging to do sometimes. And we're going to continue to grow on that foundation to provide better care for the community.